As we venture into a new decade, we find ourselves as care providers in an extraordinary situation. This is without a doubt a tough and massively challenging period for all at Balhousie Care Group. I formed Balhousie Care Group almost 30 years ago, and in all these years of providing care, there has never been a greater challenge to our company and to all our lives than the challenge that we are facing today. We have all seen the impact of coronavirus. It has reached all corners of our lives, but its impact has been most heavy and visible on our key workers. Here at Balhousie Care Group, our carers and other support staff work tirelessly day in and day out, looking after some of the most vulnerable individuals in our society. I'm usually proud to be part of our wonderful care sector during this crisis, providing care in the most difficult of situations. We all recognise, admire and cherish the work of our incredible NHS workers who have been vital in treating those who have been affected by this new and frightening pandemic. They are workers on the front line, the visible force making a difference in saving lives. Sometimes the social care sector's role in this effort has been lost somewhat in the public messaging and media. I cannot emphasise enough the valuable role my staff play in the response to this pandemic. Social care is vital in providing care to the most vulnerable in our society, but it's also vital in helping ease the pressure on the NHS. Of course, there are challenges we are trying to overcome at the moment. We are working with health service providers across the regions to access COVID-19 testing for staff, but we'd like there to be more. Access to PPE is another challenge which we are working to overcome by purchasing through existing suppliers as well as from NHS National Service Scotland, which has had varying degrees of success. We are supporting and following closely the work of our representative body, Scottish Care, who are actively lobbying the government on our behalf and behalf of all other providers regarding the availability of PPE from NSS. However, I do acknowledge the great challenge that NSS has. We've heard the phrase, "we are all in this together," many times over the past few weeks, and this could not be truer than now. From our carers, nurses, domestics, support staff to district nurses, doctors, social workers, everyone across the care sector. We all play key roles in the support of those who need help the most across the country, and we need to continue working together and looking out for each other in these challenging times. Every Thursday at 8 p.m, our key workers have been acknowledged and celebrated as we clap our hands, bang pots, and listen to the distant swirl of the bagpipes. I know this outpouring of love and support has boosted and inspired our staff. Internally, we call all our staff everyday heroes, and that's exactly what they are. The stories I hear and see about how our staffs are keeping up spirits amongst residents and each other are inspiring. From serenading them with songs, to dance challenges on TikTok, to car lift sharing and covering extra shifts, it's all the true stuff of everyday heroes. We also know this is an exceptionally draining and difficult time for our teams, with their lives being impacted fundamentally by this pandemic. We've ensured our people have the support they need, including our company intranet, a new staff phone app, our website, social media channels, and employee support phone lines, which offer counselling and information 24 hours, 7 days a week. Support has also come from the local communities we serve, where our care homes have been overwhelmed by the kindness of others. Since we made the decision to limit visits to our homes, many people, young and old, have found creative ways to lift spirits amongst our residents and staff. We've pen pal friendships created between children and residents, musicians performing gigs in our car parks, and many rainbow drawings, a real symbol of hope everywhere at the moment. We've been overwhelmed by the generosity of local businesses who have gone out of their way to make things a little easier for our staff and residents, from dropping off freshly baked scones and free pizzas to keep staff going, to hand sanitisers from a local distillery. These generous acts have been hugely appreciated, and I'd like to, on behalf of my colleagues and residents across our homes, thank each and every business and individual who has reached out to us. Like I mentioned before, we are in this together. My colleagues across Balhousie Care Group are everyday heroes, but I see everyday heroes across the whole social care sector making a difference, and it's uplifting and inspiring to be part of this incredibly hard-working group. Thank you to each and every one of you.